Hey everybody, welcome back to the vlog. I'm Dr. Sue, Cancer Vet. Thank you so much for joining me. I can't believe this is vlog number 90. My son Hudson keeps asking me, Mom, what are you gonna do for 100? I'm not sure, but today I know what I'm going to be talking about. Today we are going to be talking about communication skills. And you might be thinking, do I want to listen to this vlog? You do. Whether you're a veterinary professional or a pet owner, when you're in that exam room, there's so much information that we're trying to absorb and get. And so I lecture about this, and it's one of my favorite talks to give. And I'll be honest, it's one of the talks that so many veterinarians come up to me and say, wow, this talk was one of my favorite that you gave. It was so helpful. And to be honest, it's also one of the things that we don't get a lot of training in vet school. And when we're in vet school, we're trying to learn all this information to pass boards. And I had to learn stuff about cows and horses and, goats and all these other species that I don't even treat. So there was so much information that I was learning that the communication classes that I was having weren't always sort of top of mind. But when you're in the exam room, there's nothing more important than how you talk to the client and give them that information so they can remember it. And you as the pet owner, there are things that you can do to help yourself be able to get that information. So if you're a veterinary professional watching, I'm going to give you a few of the highlights from this talk. And if you're a pet owner, I want to give you some tips and tricks that you can use when you're in the exam room to get all of the information that you need. The reason that I'm talking about this is I just got back from K-State. So I was at Kansas State University talking to the VBMA, and I did two talks. One was on how to build a brand, and the other one was on communication skills. And like I said, this is one of my favorite talks to give. So let me give you some of the highlights and let's break it down. So let's talk about breaking bad news. So have you ever had bad news broken to you? I'm sure that you have. And I'm sure you can think back about some doctors, human doctors, veterinarians who maybe didn't do such a great job. And then you can probably look back at some experiences where you think your doctor did a good job, where you had more trust in them and you felt better about the experience. But when someone breaks bad news, they liken to it, it's like you're literally dropping a bomb on them. And again, there are things that we can do as veterinarians and as clients when we're getting that bad news to make the experience better. So I like to break it down into three issues. We want to be aware of what our issues are as veterinarians and as the pet owner, as the client. 2, where are we when we're getting that bad news? And 3, how do we break the bad news? So let's break it down. Okay, so the first one, be aware. So when I think about being aware, there's issues for both the veterinarian and for the client, for the pet owner. And they're gonna vary from case to case. But in general, the American culture is not really one that likes to talk about death and dying. So there's a lot of just discomfort and people don't really like to talk about that. And often, I'll be honest, we veterinarians, our schedules are really packed, and so often we're short on time. We may be in practices. Lots of veterinarians share with me that their practice doesn't really sometimes support treating cancer patients, that they're not thought to be referred, or that cancer is not worth treating and things like that. So there's a lot of things that go in. A lot of the times we as veterinarians feel guilty when our patients are diagnosed with cancer. We feel the burden of breaking bad news. We often are very close with our clients. We may know other things that are going on in your life, whether you're going through divorce, you're putting twins through college, just all of the other expenses, toddlers, all the other things. So we often feel that burden for you. We sometimes, if the diagnosis was made late, we often have a lot of guilt and burden of failure that we didn't, encourage you to maybe do diagnostics early. We, as veterinarians, can be concerned that you might be angry with us, that maybe you're going to be hurt with us, that you think that we didn't do a good job. So we know that you could be worried about cost, about treatment options. And again, a lot of times there's feelings of failure ourselves. Similarly, there's going to be a lot of issues for you, the client. We know that you're going to be emotional. A lot of times there's a lot of self-blame and guilt. You have a lot of anxiety, fear, frustration. I've seen a lot of clients get anticipatory grief, so they start to worry about losing their pet because they know that their pet has been diagnosed with cancer or cancer is suspected. We know that you worry about your pet's quality of life, you worry about cost, you worry about treatment options. Maybe you've lost another pet recently to cancer, sometimes a similar cancer. Maybe you had a bad experience with chemotherapy with another pet. It could be a completely different cancer and you're just worried about it. Sometimes you've had a human family member go through a similar cancer and you're worried about it as well. Again, divorce, putting children through college. You could be pregnant, trying to get pregnant. There could be so many other stressors in your life. I've often been in the room where one family member wants to treat and the other one doesn't. Or someone is single and they don't know how they're going to work and get their pet back and forth to treatment. Or they have family, but the other family members don't want to help and they feel very isolated and alone. So again, be aware of what the issues are for you if you're the veterinarian and for you, the client, the pet owner, and that's going to help us when we're dealing with these cases. My second tip for good client communication when breaking bad news is, where is the bad news being broken? And it sounds really obvious when I talk about this out loud, but ideally you should be in the room with your veterinarian in person, face to face. It's not always the case, right? Because a lot of times tests have been run, you go home with your pet and your veterinarian is going to call you up and it's going to be on the phone. And that is less than ideal. A lot of times everybody's on their cell phone, you could be driving, you could be busy. But in general, you should be going into your veterinarian's office, going into an exam room, being in a quiet, focused, personal space. That is the best way for you to have bad news delivered to you. It's not very practical, but you lose a lot of the interaction when you're not face to face. And if you're a veterinarian and you're breaking bad news over the phone, you're also going to miss a lot of opportunity to interact with your client in the best way possible. So I always encourage veterinarians to try to ask their clients to come back in, and in human medicine they will do the same thing. You will not often be given bad news over the phone. They will ask you to come in, you will have a dedicated appointment. So in veterinary medicine we do a lot of these bad news conversations over the phone, and I think that's one of the reasons they don't always go well. Clients don't remember things, there's not often good opportunity to have a good dialogue back and forth. So again, it is not ideal to do these over the phone. It does happen. Sometimes my clients are a couple hours away, so there are things that we're going to be able to do to improve the conversation, but it is not ideal to do it over the phone. The other thing is, a lot of times I've worked in practices where we're short on exam rooms, and I've thought about going in the corner of the waiting room. That is not ideal. You should be in a private space. If you're an employee at an animal hospital, and technicians, I've done surveys, told me I was told in the treatment area. So, again, everybody deserves a nice, quiet, personal space. And so, sometimes that may mean you may have to wait 15 or 20 minutes at a busy practice so they can get you into that private room. I also encourage that if you can bring a friend or an extra set of ears, that's going to help as well. All right, now we're going to talk about how we break bad news, or how we receive bad news. There's two main methods when you're breaking bad news. And so the one that I was really observed, and the way that a lot of human oncology residents and human doctors are taught, and the way that I was taught during my residency, is called the data dump method. And it's also called the shot put method. And if you think about the shot put, it's like this big heavy thing, right? And it's just thrown right at you. And that's what the data dump method is. So think about those times when you've been in the room with your doctor and they're just giving you information and you're just sitting there and you're shaking your head, you're saying, yep, maybe you're taking notes. And that's pretty much it. It's like a monologue of information. They're just giving you all of the information. So the doctor, the veterinarian is doing most of the talking, and the patient, the client, the pet owner is just receiving the information. And this was really how I was taught, and this has really been the standard for many, many years. but it's really not the best way to be giving information to patients and clients. So what is a better method? The better way is called the frisbee approach. Think about Penelope, right? So if you guys have watched any of my Instagram stories, Penelope is not going to be very content if I hold on to the frisbee, right? Frisbee only works if you're throwing the frisbee back and forth. And really, good communication, guys, is just like playing frisbee with my sweet Penelope. It is a conversation that is going to be going back and forth. And so it's a conversation, it's a dialogue, it's not a monologue. And that is how your conversations should be with your doctor, with your veterinarian, with your oncologist, with your surgeon. There really should be a conversation back and forth. And studies show that when you have these conversations and it's not a monologue, it's not a data dump, it's not a shot put of information, you, the client, the patient, will remember more. And studies show that that is true. And doctors, veterinarians, if you're watching this, your appointments will be more efficient. You will have less emails and less callbacks when you start to use these techniques of the collaborative approach, of the frisbee approach. So it's really, and I wasn't a believer of it, but I've been doing it for a couple of years, and I truly believe that this collaborative approach it's actually more enjoyable for me as a veterinarian, as a doctor, and I truly believe it's better for my clients as well. So again, let's do some of the highlights of this collaborative approach and how we can make getting information and giving information better. So my first one is I tell veterinarians to prepare themselves for this conversation, and I actually pause for a moment. I'm often running around. I have lots of things going on. I have, so many patients that I'm managing. I may be thinking about picking my son up from karate, my other son from basketball, what I have to do when I get home from work. But before I go in the room, because remember, the exam room's the ideal place to be breaking bad news, I pause for a moment, I collect myself, I take a deep breath, and I actually mentally get myself prepared for what I'm going to say when I open the door and break bad news. And I'm not just going to start spitting out the bad news. I'm going to say a simple phrase to get the client ready that bad news is coming. So I have one or two phrases that I usually use. So I usually say, I am concerned about the test result, or I'm sorry, I have bad news. And then you take a pause. And what that is doing, it's giving the client, the patient, a moment. Bad news is coming, and just gives them a moment to collect themselves. Okay, you, the pet owner, what can you do to prepare yourself? You do have some responsibility here. So if you're going in, are you focused? Do you have something to write notes on? Watch my other video. I really suggest that you record the conversation. You can use the audio, the voice memo on your phone. Can you bring someone with you so you have an extra set of ears? Do you have to bring your kids? If you do you have something to distract them, keep them busy so you can focus? I'm not bothered by your kids. Usually I have kids, right? I know the information that I'm telling you, but you need to focus on the information. If you have 3 toddlers running around the room, it's going to make it really hard to focus. Sometimes clients bring another pet because they don't want to leave that other pet home alone because they have anxiety. Again, if there's another dog yapping around the room, barking, that could make it hard for you to focus. So are you doing everything that you can to be able to focus in that exam room on the information that the doctor is giving you? Is that other pet going to keep the other pet calm? Then that's okay. But if it's going to be a distraction, then it may not be the best thing to bring that other pet. Maybe you can bring a friend to help distract, watch your kids while you're there. Sometimes I'm lucky. I have an extra veterinary technician nurse who can help with the kids, but you can't always guarantee, because if we have an emergency or we're busy with treatments, it might not always be the case. Are you as focused as you can be, ready to go at the appointment so we can get the information to you that we need to get to you? So my second tip for veterinarians, I like to say, investigate before you tell. So I used to just go in the room and just give you all that information, and I was just going to tell you everything, pretty much across the board. What's more helpful is for me to ask you, what do you know about Zach's bone cancer. And you might say, I don't know much, but you might say, we treated another dog for lymphoma and he actually handled chemo really well, so we're not that scared of chemo. Or, we had Golden and he had hemangiosarcoma and he didn't handle chemo, or by the time we found it, it had spread and, never got to chemotherapy. So I like to ask you what you know about your pet's cancer, what other experiences that you may have had, and that's going to help me shape what I tell you to give you the information that you need. So I did used to do that, but it's really, really helpful for veterinarians to ask questions before you give information, to really figure out what the client needs and what information, what background experiences that they have. Okay, so you as a client, you be prepared to ask questions as well. And I think that's going to help and give that information. Say, I'm really scared about chemotherapy. I'm concerned about having a pet on chemo in the house. Going back to what were your issues? Remember, we talked about that. Tell your veterinarian, I'm concerned about cost. I'm concerned about getting there weekly. I have no concerns about that. So again, sharing, what your experiences are, what your concerns are going to help the veterinarian, help the cancer specialist, help you figure out what's going to be the right path for you and your pet. This might be my favorite tip of the how. It's called chunk and check. So it kind of, mimics the idea of, this frisbee approach where we're having a conversation back and forth. But it's really important as the veterinarian, as the doctor, to give chunks of information and then check for understanding. So you really want to use open-ended questions, because if we say, do you have any questions? They might just say no. So you want to say, what questions do you have about the information that I just told you? What are your concerns about that? So what if you're the pet owner and you're not getting chunks of information and you're not getting the opportunity to be checked? Take the initiative and say, excuse me, I have some questions about the information that you've given me, and I'd like to ask some questions before we go on. And if that doesn't work, then to say, well, can we pause for a second? I just want to make sure I get some of my questions down and I don't want to miss anything that you're saying. And again, by recording the conversation, that's another good way with your voice memo. I'm going to put a link below for that vlog as well, so it can show you where in your smartphone you have the ability to record these conversations. My last tip in the how section is called strategy and summary. And so what's really important when you're wrapping up that conversation, when you're breaking bad news, is that the client, the pet owner, knows what the action step is. So if you're the pet owner, do you know what your step is when you're finishing that appointment? If your pet wasn't eating when you went to see the veterinarian, the specialist, are you going home with medication to stimulate the appetite that addresses nausea? If the pet's painful, if your pet is painful, did you go home with pain meds? Do you need to go see a cancer specialist? Do you know how to book that appointment? Do you need to see a surgeon? Do you need to see a radiation oncologist? What is your next action step? Maybe it is that you need to go home and discuss family finances and think about whether or not you're going to pursue chemotherapy. And that's really important when you're wrapping up that appointment, is that you know what the action step is, so you know what to do next. So that wraps up this talk on communication skills, and I'm really glad you made it to the end, and I'm glad that you did, because I think this is one of the most important videos that I have, and one of the most important talks that I give to veterinarians and to students, like I did last week at K-State. It is so important. And while it's really important to know all the information as an oncologist, and that, I lecture when I talk to veterinarians about median survival times and prognosis and prognostic factors, I often remind veterinarians, it's not what you say, it's how you say it. And it's really important that we have effective communication, that you as the pet owner are getting that information. And like I said, there are things that you can do as a veterinarian to make these appointments better, and things that you can do as a pet owner, as a patient, when you're in the exam room with your doctor, with your veterinarian, to make sure you're getting the information that you need. Thanks so much for watching, guys. I hope that you found this helpful. Please remember to comment. Please remember to subscribe. gonna throw links below to the other videos that I think you'll find helpful, specifically the voice memo one and the questions things that you need to know before you see a specialist. Again, thanks so much for watching. I look forward to seeing you at the next video.